Hello, and welcome to the Feeding Pod. This is your host. I'm Brianna Millick, and I am a speech language pathologist and certified lactation counselor. I specialize in infant and medically complex feeding and primarily see patients in the home health setting, although I do have some that I see in outpatient or via telepractice. I'm also an instructor at the university level and a PhD student studying communication and information sciences. I have a huge passion for evidence-based practice and supporting information literacy in speech, language, hearing, feeding, swallowing sciences, specifically as it pertains to social media and translational research. This podcast is meant to share anything and everything related to being a pediatric feeding SLP, feeding therapist, with sprinkling in a little bit about working in academia, being a PhD student, and how to access, appraise, and implement research into clinical practice. Some episodes may contain guests, and I'm already looking forward to some of those coming up, while others might just be me rambling about something that's been on my mind. Regardless, my goal with this podcast is that you walk away not just with newfound knowledge, but with the inspiration to think critically and not be afraid of research. So without further ado, let's get into today's episode. Welcome back to the Feeding Pod. This is Brie, and I'm so excited because I have some really awesome, important, amazing people here today to talk about feeding matters. And so I have Kyler Romeo and Athena Flichek. Did I get it? Yes. Okay. And I'm so excited because we are going to be going through, the International Pediatric Feeding Disorders Conference. We're going to talk about some takeaways, which I'm really, really excited about talking through. We're going to go through the Advocacy Pillar Symposium, which is part of the conference, but there's so much advocacy work that goes on year round constantly. And so I'm really excited to bring that to the forefront and really share how feeding matters is more than just a family resource, but really something that can help across the globe. Like right before we got on this call, Kyler was saying it's very systemic. Like we want big change. And so it's not, yes, we have family support through Feeding Matters, but also for clinicians, for organizations, and really making change for pediatric feeding disorders. So I'm really excited that you all are here to talk today. So what I'm going to do is I'm just going to kind of pass it over to you. Give us a little background about who you are and, how you found Feeding Matters, like where you started with them, and then your role with them today. So Kyler, I'm going to have you go ahead and go first.
Okay, great. First, thank you so much for having us. We really appreciate the time and the energy that's given to just spreading the word about how we can come together and support all of our families with pediatric feeding disorder. So my background is in feeding skill. I'm an occupational therapist by clinical trade. I'm board certified in feeding, eating, and swallowing. I'm also an IBCLC. And if I kind of look at my clinical history, I've worked in every arena focused on feeding, because I started with my level 2 rotation in the NICU doing feeding and swallowing intervention, and I just never left. So I'm currently practicing at Banner University Medical Center in Tucson, Arizona. That's where I live currently. I am a Texan at heart, and that's where I was raised, but now I'm in beautiful Tucson. And so I continue to work in a level 3 NICU, and I do instrumentation on the diagnostics for swallowing and program change within the NICU. And then at Feeding Matters, I get to put on this other hat. I'm so blessed to have 2 hats that I get to wear and really bring that clinical lens and combine it with all the expertise that Feeding Matters provides on staff and through our board and our executive council and all of our volunteers to cause system-wide change. So a lot of people always ask, what are strategic initiatives? Strategic initiatives is when you just kind of take this high level view and you have awareness and understanding of what's happening at different levels of care. So you understand what's happening with policy and the legislation, with clinical practice, and most importantly, you're responsible for tapping into the needs for the entire community. So that's having these conversations with people that influence how care is delivered, and most importantly, having a connection to other areas of Feeding Matters so that we are elevating the family's voice. So that's a little bit about me. I'm a mama of 3 kids. I have identical twins and then a singleton. They're a year apart. So if I'm not working, I'm mama working. That's pretty much my story.
Yeah, that's never off the clock work, which
Yeah.
I'm sure Athena can relate to. So Athena, I'm gonna pass it over to you. Thank you, Kyler, for that. That is super helpful understanding your background there. So Athena, you're up.
Thank you. I also want to say thank you for having us. We just love talking about what we do and how to help all the kids that have PFD. Our personal background, I know how important that is. I from Minnesota, which is where I am right now, visiting my parents. And my background's in education. So I got my teaching license in ESL way back in the day. And then I've taught all ages, kindergarten through adults and GED. So that's where my background comes from. And then I moved to Arizona where I live now. And I had my beautiful son, Ari, who had trouble feeding right from the get-go. So, and they were looking at me and I was looking at them and no one was looking at him. And I was like, okay, what's going on? So after a year and a half of just straight up struggles, joy in there as well. But when you have that much struggle, it's sometimes hard to smile when you want to. My pediatrician was like, why don't you check out this website, as I was walking out the door after crying in her office for an hour. And she's like, why don't you check out the Feeding Matters website? So I checked it out, and it took me a little bit to get the courage to go online, because it's like you have to like admit like, yes, I need help, which is hard when you're trying to like supposed to do it yourself all the time, and everyone's taught to like, oh, it's a struggle for everyone. Just get through it. I was like, I'm not getting through this by myself. So I went online and clicked on the help button, and that's how I got involved with Feeding Matters. I was with their resources, and then I got called in by Jacqueline to help with a little volunteer thing. And then there was a job opening last year, and I applied, and now I'm the program and events manager, and I managed our amazing conference and all of our amazing committees, which you're on, and thank you for your service. And it's just a great way to put all my passions together of education and now PFT with Ari and how much he's grown, but still struggling. And it's an amazing, amazing organization.
Awesome. I love that I have both of you on here, because we have like a professional in the PFD world who found their way to Feeding Matters, and then also a mama who found her way to Feeding Matters. And then both of you are so kindly giving back to the Feeding Matters and the PFD community. And it's just super, super awesome. So
Thank you, Bree. I did not answer the question of how I got involved in Feeding Matters, which
yes.
so serendipitous, because I'm here in Tucson, Arizona, and I had started with 4 other OT partners of pediatric feeding specialty clinic here in Tucson. It's called Mealtime Connections. And one of my business partners she's pretty well known and published author, Marcia Dunn Klein. She was very involved, like from the get-go with Feeding Matters, when it was really this grassroots campaign that was driven by families.
But when it was Popsicle still?
Popsicle, yes. Back in the day when it was Popsicle. And she was the one who said, oh, they're doing some really great work in Arizona. And I have background in system change and like the payer relationships and that sort of thing. And so she put me on like a list to be a volunteer. And I did some volunteer work for them. And when they received some funding for this position, they gave me a call. So that's how I found Feeding Matters, is through the professional connection. But again, it was knowing the organization and volunteering and just really being invested in the mission. I think that's led both of us to where we are and how we work with Feeding Matters.
Yeah, that's awesome. No, I think that Feeding Matters, like you said, the mission and everything is just so amazing, and all the work that's being done, that I truly feel like as a volunteer with Feeding Matters too, that like, I don't want to leave it. It's like once you start, you're like, oh my gosh, everybody here is amazing. The community is great. Like, I always feel so good about myself. I'm like, everyone's like, great job. I'm like, I don't even know that I did much, but like, thank you. Like, it's just everyone is amazing. And so
you do so much. Volunteer is how to start, obviously, with a small nonprofit. And literally a lot of people, like committee members, want to grow with us. And as we're getting bigger and bigger now, it's like we're adding more position, like we are growing as an organization. So it's a great way to get into something that's really gonna take over.
I super respect how well Feeding Matters has done with organizing volunteers and approaching the volunteer base. And like, I remember the very first call that I had one on the conference committee, like the first thing we talked about was like preventing groupthink. And I was just like, I've never been part of a committee or an organization that was like, hey, guess what? We don't want one person to like do all the talking and everyone else just like fall on it, because like it stops creativity, it stops innovative thinking. And I was just that from the start, I was like, this is awesome. Like, I'm so happy that like that's even being talked about in this type of setting. So total side note, but I think it was important to share because like the values of Feeding Matters are just amazing, amazing. So, okay, so let's kind of dive into what we're going to talk about today. So first, I would like to hone in on the International Pediatric Feeding Disorders Conference, of course. And this is an annual event for those of you that aren't familiar with it. And Feeding Matters has done a really great job of providing it in a platform that is super accessible and honestly very, very affordable for a conference, which is one of the reasons I really like it. And it's open up to it's not just for professionals, but it's also for families. And like they have students that, students can attend and kind of get an idea of what PFD is. And so I really love that. But I really wanted us to kind of talk about a couple of takeaways from the conference. First, I want to bring up the keynote address of this last year. So we had Dr. Anka Roberto, and her keynote address, just for the title, was Healing Feeding Trauma, It Takes a Village. And it was just so powerful. It was amazing to hear. And, she's not just a professional who works with people through trauma, but also a mom who's been through a child who has a child with pediatric feeding disorder, who had, medical trauma that went through it. And I thought it was amazing that her daughter came and spoke as well about her experience to kind of give insight into that. And so the keynote, I think, was just incredible this year. And I think really honed in on the rest of the conference, and that feeding and eating is not just about the food we take in. And it's so much more than that. So I'd love to also hear you all reflect a little bit on that keynote, because I know for me, it was just like, I feel like my mouth was just open the whole time, just like, oh, I love this. It's incredible. I'm learning so much. But yeah, any thoughts on there?
Oh, I completely agree. I find the lived experience so powerful. And particularly when you kind of like get embedded in your day-to-day routine, whether you're practicing clinically or you're taking care of your family or you're doing something else professionally. And so you kind of stay siloed, right, in your own little community. And when we have access to hearing the lived experience that's multi-generational, I feel like that's where we really can learn. That's really where we can tap back into taking a holistic view of what is feeding our children, what is eating for our own bodies, and what really comprises of a mealtime. I thought it was the perfect way to get conference started, like you said, and also looking at the trauma-informed lens. So this is something I think that we were seeing a lot in the literature. I'm seeing at other conferences as well, but it's not quite a strong topic of conversation in clinical practice. So we're starting to talk about it, right? We're building the foundation of understanding, but it's going to take people that are attending conference to try to bring that information and pull it into what they're actually doing when they're working with families, or when they as a family are being served by others.
I think that's such a great point. One of the things I will talk about with people when I'm mentoring or teaching courses is that when we look at the 4 domains of PFD, I find psychosocial is overlooked a lot. And I think that's exactly where that trauma-informed lens and trauma-informed care plays a role. And like you said, more and more people are speaking on their lived experiences, and we have to think about that. And that's also why, as tough as it is, especially when you're a new clinician, to find out like there's no cookie cutter way to manage, pediatric feeding disorders, like this is exactly why, because everybody's experience is different, and we have to take that into consideration as we move forward.
I agree. Obviously I got the pleasure of recording Dr. Roberta. Before she recorded, we talked about, so I was like, you have to get your body healthy. And then I thought, wait a minute, like what she's talking about is you have to get your mind healthy, right? And then your body will follow. And that's why I have those things that, like with Ari, especially, like he's gone through them, but now he's in that psychosocial portion of like getting him to be more comfortable and happy around food and meal times, which he basically was born having negative food experiences. And he had that for like at least 3 years, right? And he still sometimes has some negative ones. So that kind of comes up for him. So it was just so amazing to hear her talk about that part and her experiences just as a parent and how that affects you. Like she talked about how that affected her as a clinician, and also as a mother, and then seeing a child, like all that's connected together because we all affect each other, and all of our trauma affects each other, right? We don't think about how my trauma is affecting Ari and Ari's, is affecting me. It's like a cycle. So I had to get in there and really work through that. But all the providers, like I just did an event report and the survey, literally, it was amazing to me to see like over half were like, it's like, the trauma piece is there and psychosocial is there, but you don't like think about it every day. So like having see that keynote, they were like, I'm really gonna like think about that more and put it into my practice about how that affects people and families and the children. And it was like really eye-opening for a lot of our audiences here to have that as a keynote. So yeah, it was.
Yeah, I think that
great.
goes off of what Kyler was saying as well, where like we know it's there, but for some reason it's like a little bit under discussed, and especially in the clinical setting. And I think part of that's because it's a difficult topic, right? Like it's difficult, and that's also why it's so important. Like difficult things tend to be really important. And so I think that it was just really awesome that Feeding Matters chose to do that as the keynote address, to say we're going to have the conversation. Like we're going to talk and open up the discussion about these difficult topics. And I remember during the keynote address, just like the chat with everybody going in was just like blowing up with people, like, whether saying like, I'm so glad we're having this discussion, or like, I never thought about it this way, or, fill in the blank. And so I think it was really great because it is an under discussed topic. I think it's getting there more and more, but I love that Feeding Matters said like, not really many people are bringing this to the forefront, and we're going to do that. We're going to bring that up there. So I thought that was really
mental
awesome.
health still has like a kind of a stigma to it, which is difficult. But you don't think about that with kids sometimes. You don't think about like with like early, like young eater feeders, you don't think about mental health with like kids, but it's like, no, it's there. And like with me, with Ari, I could see it from the beginning. Like even his body reaction was like, oh, that's coming from something psychological, right? You shouldn't be seeing this thing and being like, have this body reaction. So it's so interesting
One of the other things that I thought was a nice connection is that when we're talking about like, well, why are people not kind of embracing trauma-informed care and clinical practice, is that it really taps into the soft skills. It's not, I place a bite in between the molar ridges and yada, 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 or I use a particular maneuver or viscosity or something that's extremely concrete, black and white. You can look up the literature, right? You can look at and do a lit review and things like that. Trauma-informed care, you can, but it's more of an understanding and an awareness that then changes your competence in how you communicate. And so this was really brought into pre-con. So then you're seeing all these connections, because pre-con was focusing on those soft skills and coaching strategies, which is directly informed by trauma-informed care as well. Like if you have an understanding, awareness of trauma-informed care, that person is perhaps going to take the next step of, well, how does this change my approach, my communication, my integration of family planning? How do I connect them to psychosocial? So there's so many connections that came off of just that first keynote. And that was just the first hour. So
I know. And it was such a powerful hour. Like it was so powerful. I mean, just all of those takeaways and themes that we were able to get from it. So yeah, I could probably talk about that individual session for the next hour. So I'm going to keep us moving. Athena, I would love if you could give us just like some of the like hard stats behind the conference. Like what were some of the things that were achieved this year in terms of who was there, what are the numbers at, maybe just like a little bit of the, feedback of what other people said as well. And then I have a few takeaways that I want to share in general, but I'd love to get some of that information first.
Yeah, definitely. So this year we had 1,040 people, which was amazing. My goal was just to get over 1,000 because this year we were co-scheduled with a couple other major conferences. So we're not doing that next year, everybody. Don't worry. And everyone's, because we have announced that we're going back to in-person in 2025, but we will always have a virtual conference because we're always going to have that. That's part of our strategic plan, is to always be digital first. So no one worry. People were worried in that survey. They're like, don't take it away, the virtual. Don't worry. It's always going to be there. But out of our 1,040 people, as usual, we had about 60% are healthcare professionals, 10% of community members, 10% family. So those numbers for me are always a little bit low when I think about like who's coming in. But again, we are trying to get the word out there, and people that are working with PFD are those professionals. So it's important to get them the information. We had some big groups coming in. Our biggest number, of course, is SLPs this year. They were at 40%, and then our OTs were at 20%. And then diet and nutrition was at 10%. And that number grew a lot from last year, which I was happy about. And a lot of people want to see more talks about nutrition and things like that when it comes to PFD. So that was really interesting to see. And then we had people from 65 countries, all but one continent of Antarctica, which is double what we had from last year for countries, which is super awesome to see. And then we had almost all the states. I won't mention the states we didn't have because it always makes me a little upset. Well, it's okay. We're going to get there.
Prioritize those states next year.
I know.
Where are you?
Where are you? Have you not heard about us? We know you have children in your state.
Yeah, certainly.
For sure. We're really. But we saw some big group stuff, but we also have 10,000 hours of continuing education earned, and people were overall, everyone loves the parent perspective. They love the trauma-informed care. They love the lightning talks, or everyone's like those 12 lightning talks were all the rage, and they're always amazing. But this year was like, these are the best ones, and there were 12 of them, so people really had to sit through like 12 lightning talks, and they were amazing. People love those little short bits. So those are the hard facts.
Awesome. I love it. No, I mean, that's huge. Just like what a testament to the impact that you all are making. I mean, that's just.
I did want to shout out to Dr. Roberto. She had perfect attendance for her keynote. We've never had a registrant number match our keynote, like our perfect attendance. Perfect attendance for our keynote, which really says amazing.
Give her the certificate.
I know, I need to get her one.
Perfect attendance.
Perfect attendance, Dr. Roberto. Thank you.
That's huge.
It is huge.
That also shows that we were talking about this conversation does need to happen. People I think are ready for it. And so it was very appropriate. But that's so awesome. I actually will 100% second that the lightning talks this year were just exceptional. Like you said, every year I love them, but something about this year's were just really good.
Yes,
I felt like everybody who had one was just
the
incredible.
submissions were amazing. Of course we couldn't say no to we had to pick 12. We only have room for how many? We're gonna do 12.
Yeah.
And then I will say, since you talked about Marsha Duncline and a big one this year, people really love, is that compassion side of things. And a lot of people really talked about how that was amazing to see in that practice and her speaking, and everyone wants her back next year. So Marsha, if you're listening, you gotta come back next year.
Yeah, I love it. No, I think that's so important, and kind of goes into some of the takeaways that I had. So one of them was just because there was such a theme around this trauma-informed care lens, that I feel like there was so many talks that were really feeding and eating is more than just the food choices. It's about enjoyment. It's about respecting bodily autonomy. It's about relatedness and connection over compliance, and really focusing on that. And I feel like that was one of the key takeaways I had, was really that building connection and trust, and moving from there. Also, I think there was a big one on social determinants of health and health equity. There was a couple lightning talks specifically on those. And I think, and also a session that was on social determinants of health. And I think those are also very much part of trauma-informed care, and, being responsive to other cultures and other circumstances that may be going on. And I thought that those were really, really great. And all of these do lend itself back to that family-driven model, right? And keeping the family at the center of every decision we're making. One thing that I will say that kind of had me challenging my beliefs a little bit was there was one session where it had an approach that was a little bit more behavior-based, and that's very different from the way that I go about therapy. However, I think it was important for me to still go to it and be part of it, because it's okay to disagree with approaches. It's okay to recognize that there's other ways to go about something. And a lot of times you can still gain information from them. For example, with that one specifically, I remember walking away and saying okay, so we have this literature that says this type of approach works, but we also have a lot of literature that shows about being responsive and, prioritizing connection. So how can we implement some of those approaches in a more responsive manner? So I think even being able to take that away was really good, because I sat there and I was immediately want to be nope, just nope, not going to listen, And it's well, that doesn't do any good either. So taking that information, saying I don't agree with all of this, but how can I, make it fit for the way that I go about approaching it. So I thought that was really cool. And then the final like main theme that I had was that feelings of competence don't only matter in the child and making the child feel competent in what they're doing, but we also have to make sure that the families and the caregivers feel competent in what they're doing. And I think we're really, a lot of times as feeding therapists, it's like patient, 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 right? And it's like, well, we also have to think about the family. And so when we're providing recommendations or strategies or trying to like support a plan of care, we want to check in with the caregiver and make sure that they feel like they are capable of everything that they need to do to support their child, and making sure that we're helping them better understand treatment plans and the process, and like what would the next step look like, if this happens then this, and really helping talk through that process. Because I think building that feeling of competence, like self-efficacy, can make such a difference in carryover of strategies, home programming, making sure that the caregiver understands that like they are the best option for their child, and they do know their child the best, and that they are capable of, all the things that we were learning about that we're going to then, regurgitate to them, that they're completely capable as well. So yeah, those are kind of my main themes from it, which is so many.
I love that
Great
that you
takeaways.
bring up the family side and the focus on the family, because that's just like one of the key tenets in my own treatment approach is I consider my client first is the family, is the parent, is the caregiver. The child, of course, is a primary client if I'm like working through medical complications, but a child is dependent on the parent and the family unit to provide everything associated with the mealtime experience. So like really, who is our primary client?
Mm-hmm.
It's whoever is providing the meal
me.
time.
I'm just kidding.
It's the parent.
It's so funny. This happened to me we started beginning right before COVID. So we had one session in person with Susan Hodges, our amazing OT, and then COVID hit. So then I was at home and I was thinking, I just had hope. And now I'm like, I'm expected, right, to be at home with this child who I'm working through feeding therapy with like a Zoom. Here's Susan on Zoom. Come here, Ari. And I put her on the table, he's like coming to the table. There's Susan. But I was like, she really empowered me to feel like I can do this. Here are the strategies. And she was amazing with Ari as well. But you're right. Like I needed that support from like that guidance from her to really move forward in the way that, because it's like we tell our, like as a teacher, if you don't do homework, you're not going to get ahead. Like that's what it is, right? If you don't do your homework, you can't just go to the class of therapy and then just leave it. Okay, well, forget it. That's not
and
gonna.
to give credit where credit is due. So if that child is making progress, if you're seeing positive changes, we should not be patting ourselves on the back as a therapist or a clinician or the physician or whoever. It's the parent that has done that. It's the parent and the child as a connected team, not us as the therapist. If we may be a coach, a support, a catalyst, but we are not the people that should be getting the recognition for those advancements. I'm super passionate about bringing that forward.
I 100% agree. I always like bring back to parents. I'm like, they're like, hey, this started happening, or this has changed, or this has improved. I'm like, that's a testament to you. Like 100%. Me coming one time a week or even 2 times a week and doing this, like it's not going to make any type of change unless it comes for you. And then I think also part of that building the competency and doing it in a family driven manner is making sure that we go again back to those soft skills, Kyler, and making sure we're connected with the caregivers as well, and that they feel comfortable saying that strategy is probably not going to work for us. Like, is there something else we can do? Or, hey, we tried this, but it didn't work. And making sure that they're comfortable with saying when things don't work and how we can modify it from there too.
It really brings back to the family education forum, which some people may not be aware that this is an event that's open to the public and is connected to our conference as well. But we recognize that families need empowerment through education. So when we have our first day of conference, we kick it off with pre-con, which is focused on family-centered care principles and tenets. And then right immediately after, we have the family education forum. And this is specifically for families, where they can come in and have connection and education. And my takeaway from that was that families left that 2-hour event and it caused them to have different conversations with their teams, different conversations with their physicians, and have immediate change. And I thought, gosh, we do so much continuing education and focus on education of the provider, people serving the families. We need equal, if not tenfold, education supports for families since they are the outcome. So
Yeah.
this is something that we are going to continue to grow in the future and continue to build on that base.
Yeah. I love that because I think ultimately, like, caregivers are the best advocate for their child and they know their child best. And so all of this just helps with that empowerment. And again, going back to building their feelings of competence, like feelings like I am capable of asking for what my child needs, doing what my child needs, and not feeling like, oh, well, they're the expert, so I'll just, listen to them. I'm like, no. I have, training in feeding, but you're the expert on your child. And so I need your expertise throughout this whole process.
We're definitely a team. Like I would say, no one can do it by themselves. That's 100% true. That's why it's so great to see the session, the collaboration sessions that we had this year, and people really like reaching out. Once people were providers, they would reach out to other disciplines to work together once they saw some of the sessions, and it's just so important to do that because it takes everyone, and we all and parents need confidence because when you're a kid, you can't feed your child. It's it takes a huge piece of you away because you're supposed to be able to feed your child. That's oh, that's easy. It's natural. Yeah. Right. And when you don't, so building that is really important. And a lot of people, providers this year wanted to see lightning talks from parents. And I was like, what a cool idea, right? To have a lightning talk from a parent. That was a lot of people mentioned that in the survey. So I think that would be great to have.
I love that. Well, we'll do a plug at the end for how people can submit for sure. So any caregivers listening, it would be really helpful. Okay, awesome. Thank you. That was great overview of the conference. And the next piece I want to really highlight is the Alliance Symposium. And this year specifically, it was the power of advocacy was really kind of the main topic and title of it. And so the people that are on the Alliance or who were on the panel for the Alliance Symposium were Kyler, who we have here, Dr. Amy Delaney, Dr. Paula Raby, Dr. Aaron Ross, and then Amber Mieres, who is on the Family Advisory Committee chair. So all of those people were on the panel to really facilitate this talk. And Kyler, I'm so happy you're here to talk with us about it. So if anyone is unfamiliar with what the PFD annual symposium is, it's one of my favorite sessions because it's so interactive in nature. So I'm going to kind of read the little blurb, but basically it's a live event where the participants that attend have the opportunity to share ideas. So you're sharing your challenges, your barriers to implementing care that you want to, as well as generating ideas on how we can better support families and clinicians that are working with children with pediatric feeding disorders. And I just think it's just awesome because it always brings up so many cool ideas, but also as a clinician, I can say a lot of times these are validating for oh, you are having the same barrier that I am. And now we have all of these brains in a room to put together to say, how can we maybe overcome this together? And it's just so awesome. So Kyler, I would love to, kind of hear some of the themes that we're going about. So I know there was kind of three main areas that were discussed. So maybe first, what were some of the, key advocacy needs or ideas that were generated through the symposium?
Well, this really takes us back to the advocacy agenda. So the advocacy agenda for Feeding Matters is our system-wide plan for change. It's basically all the actions and the work that the entire community does. This is what we hope it's leading to change. And so we've broken that into these 6 key areas of where we feel that action and work will have the greatest impact. So that's insurance coverage for pediatric feeding disorder. That's a primary aim. Having children qualify for early intervention services based on having a diagnosis of pediatric feeding disorder is an aim. We also want an educational pathway that will lead to competency in order to serve children with pediatric feeding disorder. And then we also have representation in research. We need it to be federally funded. We needed our children screened at well check visits. And then we also wanted best practices. We want to continue to publish and develop the literature that supports best practice for assessment and management of pediatric feeding disorder. So if you kind of think of what's happening in the Alliance, what do we do? What does conference contributing to, everything's working towards these big 6 aims. So each year we crowdsource. This part of advocacy is really staying connected to the community. We need to know what people want, what people need, and what people think. So every year we do a community-driven change question. It's posted on social, it's sent out through survey, it's through our newsletters. Anyone and everyone can participate and share their voice. And then we take all of that information and we analyze it to have a better understanding of who is saying what and why. And then we bring it back to this international audience and we talk about the results of the community-driven change question. And then we gather even more input for everybody that's in symposium. And like Athena had mentioned earlier, this represents an international reach, which is fascinating to see how people from other systems of care and other cultures and other parts of the world, what their viewpoint is on how to reach that advocacy aim, or what are they doing in their own area that's causing change. Because we just need diversity, we need more ideas and innovation. And that's really what's going to cause rapid change. Like, we're in a rapid action business. We do not want to take 20 years to reach these aims. We move forward fast. We always say, fail fast, pivot faster. And that's how innovation works, particularly in system change. What was so interesting this year, when we posed the question, we're like, out of those 6 aims, what do you think would have the biggest impact? And we had our own idea coming in as an organization. And I tell you, it was not what the results were, which just highlights why you have to constantly crowdsource and ask the people that matter, which is the families and the professionals that serve them. So what came to the top was insurance coverage is what everybody was wanting. And we really thought, oh, it was go from publishing the consensus definition, and then people are going to want the next publication. They're going to want to know, well, how do I assess in management? And, give credit where credit is due. Yet again, our community was like, nope, we got that. We want to now know, how do we get coverage? How do we ensure families can get into care? And then they also wanted to know, what else can we do to intervene earlier and sooner, which connects back to the whole trauma-informed lens and responsivity to our families. So that's where our discussion circled around. We talked about our top 3 and dove in deep to hear what were people's challenges and what were their wins. And we had the most robust discussion on insurance because that was the first topic we discussed. And it is hard to contain the conversation during symposium. I feel like I need another symposium for the other 2 questions to dive into those a little bit deeper.
Yeah, like a topic discussion 1 topic,
Yes.
or even I wonder if you did little breakout rooms where you're like, if you want to talk about this one, go here. If you want to talk about this one, because
we have exciting things planned for next year. Don't you worry.
So exciting. I love it.
Athena's innovative mind has already created quite an idea for us.
I'm so excited. Yeah, I love the symposium because of the fact of how interactive it is. And like you said, Feeding Matters really does take the information that providers and caregivers share and say, okay, that's the priority for our community. And so we need to really hone in there, prioritize there, and spend a little bit more time there to support the system change that seems to be making the biggest impact, or what's the biggest barrier to getting care for families. And I think that is definitely one that I hear as well. I'm in South Carolina, and I will say that it has been really great getting coverage for the pediatric feeding disorder code. I feel like it's been very successful since the code went through, but I know other states are still having pretty big battles with it. And so, hopefully that can move forward. And I will say that's mostly with state insurance, not private insurance. Private insurance is another story, which is very difficult because that's what many families have. So,
right. And a lot of people are asking us, well, what are we doing as Feeding Matters, and what else is being done in the community? And so a couple of the key takeaways that were connected to insurance coverage is that we're seeing a powerful use of published materials, collateral, and resources that are free and open access provided by Feeding Matters. Because that's what our job is we're to provide the resources and empower people to use them. We do not want to reinvent the wheel. We want to spread the information so that all these different actions can be taking place in a system way that makes sense to that person.
Mhm.
So what one I thought really powerful example was the consensus definition. So we did have an institution that took the consensus definition and submitted it to a particular payer as new evidence, and then requested funding for multidisciplinary evaluations within that facility because it was supported by the consensus definition, and it was approved. So you took the current literature, you cited it, you had a peer-to-peer connection call, and now they're being covered for multidisciplinary evaluations. It's really about taking the collateral, learning the collateral, knowing the collateral, and then how are you going to leverage it. But we do feel like we need to have more, and we need access to the information, like I said, in real time. So what y'all can expect in the future is that we're building out a landing page where people will be able to submit their wins and their barriers for insurance coverage, and kind of fill out key fields. Who is the payer? What's your state? What's your country? Who's the provider? Like gathering that information so that Feeding Matters can take that information and use it to power the conversations we're already participating in with the payers. So that's something that we're doing for our community for system change, is that we're having those conversations. But there's much more to be developed in this area, and people need tools so they can do things quickly.
No, I love that. I think that's really helpful. And I'm going to be sure to put in the show notes some of those resources that are already available. Like I know there's the, like the consensus paper, of course, but there's that whole entire resource on the ICD-10 codes and what the, the definitions and what they mean and how to use, and, some of those resources, because I think, like you said, it's like, okay, Feeding Matters has gotten it for you, and then you have to take it from there. And so knowing where to find that will be helpful. So yeah.
Like for that consensus paper, like as a parent, like I was in education, so it wasn't as intimidating to me to read that, but like every parent needs to read that. And then I read it about 4 times a year, because every time I read it, like something new pops up for me about Ari and like what he's going through. And it's so helpful to know. So yeah, we've done, that's going to lead to a lot of things.
The paper is,
don't be afraid to read the paper.
Yeah, it's incredible. And I think, like you said, like when you think about a paper, it can be intimidating, but it's really so well written that I truly think caregivers can understand it. So
yes,
yeah,
if I can, everyone else for sure can.
Yeah. Okay, so I'm going to shift gears a little bit. And before we go into kind of, some of the where is Feeding Matters going from here and how people can get involved, I want to do some rapid fire questions for you both. Okay. So the idea behind this is that you just answer with either like one word or just a short phrase. So I don't want you to elaborate, just like whatever comes to mind. Okay. All right. So I'll start with Kyler for this first one, and then Athena, you can answer it as well. So what is a book that you think every feeding therapist should read? Gosh. And it doesn't have to be directly feeding. It could be like, I have a book in my brain that I think everybody under the sun should read. So
I'm just so ingrained in my Bibles of feeding that I had, from the time that I was a student, which is Wolf and Glass, the Purple, the Bible of Infant Feeding, and of course, Marsha and Suzanne's book, Pre-Feeding Skills. But if I'm going beyond that thought process, gosh, I have quite a few inspirational books that I read about the lived experience, but I have to tell you, they're religious in nature. So I'm going to stick with my Pre-Feeding Skill and my purple book.
Okay. I love it. Athena?
Mine is The Out of Sync Child Has Fun, because I love that, because it's like you can bring that into feeding, and like Ari has a sensory processing disorder, which a lot of kids that have BFD have something going on different. So I love that book. It's got a lot of good ideas that you can take out and do from, and it's just make it fun.
Oh, I should pull things off my shelf. I'm like,
I was gonna say, otherwise I'll be reading some murder mysteries, because PFD sometimes feels like a murder mystery.
You are like a detective, like a dysphagia detective.
What are these clues telling me, and how do I figure out the problem? And my therapist is telling me, you're not a doctor, that's not your job. I'm like, thank you. I love it.
Oh gosh. So I really I'm sitting right here at my bookshelf, and I could just pull all of these books and just show you like one after the other. I mean, I have 40, 50 books that are sitting here.
I love it. I love it. My book, just so you all know, if you haven't read it, I highly recommend everyone reads the book Think Again by Adam Grant. Just, it's so good. It's about
Well,
like
I'm
the
gonna put it on
power.
my list.
Yeah, it's about like the power of like rethinking your beliefs and not being afraid to challenge them in the face of new information. And just, it's incredible. I also love his podcast, Rethinking, but the book is, it's top notch. Okay, here's your next question. Athena, you're going to go first for this one. What's your favorite type of food?
Greek food. Does that even have to be answered? I was born in Greece. I lived there until I was 9, and everyone should eat Greek food.
Love Greek food.
Obviously.
Tyler, what's yours?
Okay, I really struggle with this question. My children love to ask me this question, like, what's your favorite food? What's your favorite meal? What can we cook you? Because my kids are very independent little chefs and everything. I have the hardest time even picking a genre. I'm gonna say Thai.
That's my favorite.
Yeah, okay. I always think if there's only one.
And it's
food
okay.
that
It can change. That changes for Keller. She takes the longest at restaurants when we go out to eat to pick, what are you getting? No, what are you gonna get? Well, what are you getting?
That's
And then I eat bites of everybody else's food. I'm like,
Yeah.
can I just
Oh
have a
yeah,
taste
I'm
of
definitely
that?
not picky by like genre of food, but like if I had to pick one, it would be Thai. I love Thai food. Okay, last one. And then Kyler, I'll go back to you first. What is one word or short phrase you would say to describe Feeding Matters?
Innovative, family-centered, and a change agent.
Love that. Athena?
My 2 words were compassion and change.
I love that. You both really went around that like change theme, right? And like that's the goal of it. That's what we've started talking about, was like system change and how we can, support change in the right direction for children and families with PFD. So thank you. Okay, so to kind of wrap things up, I would like you all to share, when is the next conference? What's the call for papers? Hint, hint, caregivers. We would love to have you do a lightning talk. Let's start there. Let's start with just conference. What's coming up? When's the call for papers due and all of that?
The conference next year is April 25th and 26th. There are no other conflicting activities, anyone, so sign up.
Save the date.
Save the date, April 25, April 26, and pre-con April 24.
Perfect.
We changed, the call for papers is open right now. It opened on, what day is it? June 15th. It goes to August 15th.
Okay.
So we changed our format, which is super exciting. We heard back from our audience, so we still have our amazing 5-minute lightning talks. We have a brand new 20-minute pre-recorded session. So we're super excited for that format to go through. And then we've changed our longest one is now a 45-minute pre-record with a 15 Q&A. So just an hour cap on that, because we realize people have a lot to do. They want the information in smaller bits, shorter pieces. And so we're really excited about those. And we're thinking about diversity. So just all parts of PFD.
Yeah.
And students submit your work. Researchers come in here, families, let's see it.
Yes.
We're excited.
Yeah. I love that. I'm really excited about the change of format too, because I think it opens it up to more topics to be talked about as well, because you're not just having a bunch of really long sessions. It's like we can add so many more topics of discussion. So I'm really excited about that. Okay, second question. How can people get involved with Feeding Matters? Where should they go, if they want to sign up to volunteer some of their time?
Well, people can participate at any level. So the Pediatric Feeding Disorder Alliance is like where this work is done in the committees. As Athena's talking about, we have a conference committee, a pre-con committee, a digital outreach committee, and then we tap into our volunteers for projects that are occurring behind the scenes all throughout the year. So this is not representative of, even close to being representative of all the work that these volunteers do. The best way is to sign up to be a volunteer. Yeah, if you go to the website, feedingmatters.org, and you look at the top, the green tabs, there's one that's just tabbed Get Involved. Go to that tab and take a look at how to sign up to be a volunteer. Our volunteers go through a formal onboarding. So there is a process so that you're really well oriented to the organization and you're vetted, because our volunteers do amazing work and we want them to feel supported. We also have an open call for leadership. So we had our open call recently and it's just closed, and we'll be slating our committees and our leadership, but you can submit your interest in serving as a leader at any time. And we save that information. And during the next open call, we revisit it to look at who has submitted their information. But I would say also just sign up to be in the Alliance. When you sign up to be in the Alliance, completely free, no membership fees. It connects you to Feeding Matters through communication. A majority of our community is at-large members. That means they receive our newsletter. They receive email blasts of events. And the best way to participate is first just opening your email, reading your newsletter, staying informed at the grassroots level. If you want to be more involved and more tapped in, you can also download our free app. So this was something that was new last year, is that we did launch a free Pediatric Feeding Disorder Alliance app. So you can go to your app store. If you're still Android like me in an Apple community, you can find it for Android or Apple. Just go to your Play Store and put in the words Feeding Matters, Pediatric Feeding Disorder Alliance, and you can join that. And that allows you to connect and chat with professionals and families. And then we also have protected groups. So there's a group that's just for families so that they can share openly, as well as one for professionals too. So those are some ways to stay connected with what's happening.
Awesome. Thank you. That's so helpful. And that kind of goes into my last question, which was, where can people find Feeding Matters? So of course, the website, feedingmatters.org. And then Feeding Matters is also on Instagram. So you can find them at Feeding Matters. Is there anything else I'm missing in terms of where to connect or find things?
We're on Insta, we're on Facebook, we're on Twitter. So all your social media channels we're on as well. And we also have a YouTube channel that does have some great videos that you can use in your community. So everything that is on the website is on YouTube, posted on social. We want people to use. It's open access to everyone.
Awesome. Great. Well, thank you both so much for being here and chatting with me. It was such a pleasure. I mean, beyond a joy to talk through it. I know all three of us could talk for hours on this topic. And so it was, super, super fun to have you both. And I thank you so much for what you do for the PFD community and giving back so that, professionals and families can feel supported, feel empowered, and to make system change, because like you said, ultimately that's the goal. And that's where we're going to see progress if we want to see change. So I appreciate you both.
Thank you, Bree, for having us. You're amazing.
Of course. Thank you. All right. Enjoy the rest of your summer.
Right.
Bye.
Bye.
Thanks for tuning in to the Feeding Pod this week. If you enjoyed today's episode, please don't hesitate to share this podcast with your friends and colleagues and leave us a 5-star review wherever you're listening from. If you're interested in learning more about pediatric feeding and swallowing, be sure to follow Bree, me, on Instagram at Pediatric Feeding SLP, or check out my website where you can get access to more courses and information, www.pediatricfeedingslp.com. Again, thanks for being here and listening to my ramblings, and I hope you'll keep listening. Until next time, cheers.